essential from the start of this pandemic, and now some farm workers say they believe they should be next in line for the COVID-19 vaccine. However, concern is being raised on when they will actually get the vaccine based on their placement in the distribution tier system. 23 ABC's Kylie Walker is joining us live tonight from Kern Public Health in East Bakersfield with the details on what the California Farm Workers Foundation says about that vaccine distribution. Kylie?
Our farm workers have been working on the front line since the start of this pandemic in order to provide millions of Americans with food on their tables. But now one organization is speaking out, saying that our farm workers are putting their lives on the line on a daily basis and that this vaccine is greatly needed.
At any given day in Kern County, we're testing up to 500 farm workers per day. What the data is telling me is that the spread is real. Our numbers compared to 2-3 months ago are significantly higher.
They're one of the more affected groups when it comes to COVID-19. And studies like the one from the California Institute for Rural Studies shows that agriculture workers were 3 times more likely to contract COVID-19 than those outside of the industry. And Hernan Hernandez with the Farm Workers Foundation feels that the group continues to face challenges, including being overlooked during the pandemic.
When we think about essential workers, we mostly think about the medical sector, right? We think about law enforcement.
But as a key component to the food chain, Hernandez believes farm workers should be at the forefront of the vaccine distribution, as their job duties are just as important as any other essential worker.
Hey, these are the individuals that are putting food on your table. And if it wasn't for them and their sacrifices on a day-to-day basis, then guess what? We wouldn't have food. Our food chain would be completely cut off.
And according to public health, there could be some time before this can occur, as farm workers have 2 groups ahead of them. And we are currently in phase 1 of the vaccine distribution process, which includes paramedics, EMTs, and more. The second tier will include, but is not limited to, public health field staff and those in primary care clinics. And those who qualify to get vaccinated in Tier 3 directly before the farm workers would include dental clinics, pharmacy staff, and more.
Which the state has defined as our first responders, education, food and ag, transit, grocery store workers, and a few others.
Constantine says this group means a large number of individuals will need to be vaccinated, and they believe setting up large mass vaccination clinics would be ideal.
Growing the fairgrounds would probably be a good alternative. We're going to still rely on our local providers, those 80 or so.
As for Hernandez, he says the county also needs to have more educational resources about the vaccines, since he says about half of our local farm workers either wouldn't take it or are undecided about the vaccine.
But without the education component, then we're going to have the same failures that we had in the beginning of the pandemic.
Now, I did reach out to our Board of Supervisors to find out what they had to say about Public Health's mapped out plan, but I have yet to hear back. Now, for a full list of all of the tier systems and who qualifies, we will have this information on our website, turnto23.com. In Bakersfield, I'm Kylie Walker, 23 ABC, connecting you.